Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop sciatica pain. But before we start going over the steps that can be taken to stop sciatica pain, we need to understand what is sciatica, the causes, the risk factors, because those are very important to help us to avoid sciatica pain and manage it or even overcome the sciatica pain. So first, what is sciatica? So typically you start to experience pain in the lower back and the buttock area, and sometimes radiated pain going down to your legs. Some of the symptoms could be numbness, tingling in your legs, and also you might have experiencing some weaknesses. So the pain increase usually with movement when you do movement, and also pain decrease with rest. So that's very common with sciatica. There's several causes for sciatica, and we need to understand those causes because that will help us to know what is the best approach to treat it. So, because it's a very umbrella name for a lot of causes, it's really good to understand what could be the trigger. So one of the triggers is herniated disc. So that's happened if in your vertebra you have a herniated disc, like here in the image. And actually you can see here, I'll show it to you in the model, the skeletal here. So one of the reasons for sciatica could be that there's herniated disc, and you can see it here, the red part in here. That's when the disc between the vertebra start to sticking out, and when that happen, it compress on the sciatic nerve. That's the yellow part, sorry, that you can see it here. Okay, so you have the herniated disc in here. That's the red part, that's the disc, and you have the vertebrae. This is the nerve that's coming down. The sciatic nerve is coming here, and actually what happened is the herniated disc is actually compressed on the nerve, and that could cause sciatic pain. I want to emphasize that it's not all the sciatica pain coming from the herniated disc, because several studies shows majority of the people have herniated disc, but that does not mean the disc is compressing on the sciatic nerve. And it's misperception with a lot of healthcare providers. If it's sciatica, if it's back pain, whether radiculopathy, like numbness going down to the legs, it's always herniated disc. That is inaccurate. So, because I'm gonna go over the list and we're gonna go over the causes and the triggers, and it will make sense. This is not the only thing. We all have herniated disc. If you are, especially if you are 40, 50 years and older, we all have herniated disc. That does not mean you have your sciatica from herniated disc. So that's one of the reasons. The other reason could be arthritis in the vertebra itself. So if you start to have arthritis in the vertebra, like here, you will see it in the next image in here. So the disc start to kind of shrinking, and actually those bone spores start to push on the nerve. So that's another reason for it. The risk factors is actually overweight, but let's go back to the causes. So the other cause is stenosis. It's not as very common as the other ones on the list, the osteoporosis or the herniated disc or the performance syndrome. So spinal stenosis, which mean that we have the canal, the spinal canal in the middle. You cannot see it here, but it's internally you have the spinal canal. So you see the nerves coming out here. Those nerves attached to the spinal cord, which is actually attached in the middle and going through the spinal canal. So spinal stenosis, it's basically that canal is narrowing. Instead of like its open canal like this, and the nerve is going through it smoothly without pressure, the spinal canal is kind of like narrowed down and it compress on the nerve, and that could cause kind of sciatica or radiculopathy pain going down. So the treatment is different a little bit between some of these issues, but when we understand the normal healing cycle, it will be easy to address them because it's the same healing cycle that happened with any issue of these. The other reason that extremely overlooked is performance syndrome. So performance is a muscle that attach in the pelvis area, and it's usually attached in the back here in this area, left and right. What happened is the sciatic nerve comes down and goes, 20% of the population is actually the sciatic nerve goes in the muscle itself. So the performance muscle is kind of split like this, and the sciatic nerve in the middle going through it. And that's kind of risk factor to have sciatica, because if you have any muscle spasm or scar tissue or tightness in the performance muscle, it's gonna squeeze on the sciatic nerve and actually cause the radiculopathy. The other issue is you might not have that bad anatomy, but if your performance is very tight and it's in here, and you have a lot of scar tissue and a lot of tightness, that will compress on the sciatic nerve that's underneath it, because the sciatic nerve has to go down this way. And that's extremely overlooked, and I see it with a lot of my patients, because a lot of the time doctors look at image in the back, looking at the spine, the vertebra, the disc, but they don't assess properly the performance muscle, which is very, very common with sciatica to have performance issue, and that could cause sciatica big time. I will have a video on performance muscle in the future to talk about it in detail. So the other causes is spondylolisthesis, which means leverage in the disc, like a little bit fractures in the vertebrae, and it's not very common, so I'm not going to spend too much time on it. Tumor in the lumbar spine, it's rare cases. Coda equina syndrome, it's rare cases, so I'm not going to spend too much time on it. So what are the risk factors? So risk factors is, the first one is injury your back, and usually that happens from poor body mechanic of lifting, and that's extremely important because I'm gonna have a video on how to lift properly. So especially happen when you do a heavy lifting with twisting and you're not engaging your core muscle, and we'll have a video on that. Make sure you subscribe to the channel to receive the notification for those videos. The second reason is herniated disc. Overweight is a risk factors to cause more issues in the back. Weak core muscles, so we have to address a lot of these to decrease the risk factor and help to recover from the sciatic pain. So the other risk factors job requires heavy lifting. It's common sense. You do a lot of lifting, there's a lot of wear and tear in the muscle and wear and tear in your vertebra. You start to build you will start to have orthotic changes, which wear in the joint itself. Poor lifting body mechanics, diabetes, back osteoporosis, smoker, and sedentary lifestyle. So these all risk factors to have issue with sciatica. So how to treat it? Well, to answer this question, we really need to understand what happened internally in the body as normal healing cycle. So I'm gonna use external paper cut here, but to visualize the normal healing cycle, but the same process happened internally when you have sciatica from herniated disc, performance syndrome, spinal stenosis, or osteoarthritis. So the first stage is inflammation. Anytime you have any injury in the back or anywhere in the body, your body starts with inflammation, which means that you will start to have swelling, redness, and the blood start to rush to that area, as you see here in this area. And you see it here in the image here, inflammation and swelling that cause herniated disc here. And also you see inflammation, and could be in the piriformis muscle here that compress on the nerve. So we need inflammation, but we don't want the body to be in inflammation for a very long time, because that swelling gonna compress on the nerve, and that's what causes the nerve pain or sciatica. Second stage is a proliferation stage. So anytime you get any injury anywhere, it does not matter. So for the sciatica, any injury in the spine, in the vertebra or the disc or the piriformis muscle, you will start to build the scar tissue. The scar tissue is like the glue that glued the teared tissue. We need that when you have any injury. The problem is when you have excessive scar tissue that could compress on the sciatic nerve and cause the sciatica. So during the proliferation stage, you start to have scar tissue, fascial restrictions, muscle spasm, trigger point. You can see it here in this image. So perfect scenario, actually, during the maturation state, the body should get rid of all of this: the scar tissue, the fascial restriction, the muscle spasm, and the inflammation. So that could take days, weeks, months, or years. If you are in chronic sciatica or back pain, that's a sign you are not healing. So your body probably going back and forth between inflammation and proliferation. I have seen in the clinic some patient purely sciatica is stuck in the proliferation stage, especially if we have a piriformis syndrome, that a lot of scar tissue or trigger point in the piriformis muscle that cause a muscle spasm and cause compression on the sciatic nerve. But other patients, they actually have inflammation plus issue with the proliferation. So to really treat the source of the problem instead of the symptoms, we really need to address the inflammation and the proliferation. And we'll go over how to do that. And we have to do certain exercises and core stabilization. I will go over the summary of the treatment plan at the end, but it will not make sense unless you really watch this video to the end, because all this information build on each other. So what kind of treatment we can do for sciatica? I'm gonna go over the ones that actually does not work, so you don't have to waste your time on it. So ice and heat, that's temporary, especially the ice is gonna decrease inflammation. It's not gonna do much for inflammation, it's temporary. It's not gonna do much to proliferation stage. The other thing is electric stimulation. I used to use it in PT before I started to work on the healing cycle effectively. And that's provide temporary pain relief for half an hour to an hour if you're lucky, but does not do much to really break that vicious cycle of inflammation and proliferation. The other thing that been used in physical therapy with a lot of athletes, they use it is foam roller, which is actually rubbing over the back or the piriformis muscle. The problem with the foam roller, if you have inflammation, you're gonna inflame it more. So if you have an open wound or inflamed area and you rub it, you're gonna make it worse. The other issue with the foam roller is, based on the studies, does not provide long-term relief. So it provides temporary result. And the third issue is it does not go deep enough to do deep release. So it's not a very effective treatment. The same thing happened to the massage. And when I go over the fascial layers, it will make sense why massage and foam roller are not effective. And the study shows actually to provide temporary pain relief and sometimes no pain relief. So, but when you understand the science and the anatomy of the body, it makes a lot of sense. Those two treatments really does not provide long-term result, because mechanically impossible to go deep to address inflammation or the different issue of the proliferation here. So the other thing is stretching. Think about this way, and I have a video why you should not stretch. If you have a tear or inflamed area, like a tear muscle, like example here, like your muscle should act like a rubber band, like this. So when you have a tear and you start to stretch it, what's gonna happen? You're gonna tear it more. So a study shows actually stretching could increase inflammation could cause more harm. So there's other alternative safe option than stretching. I don't recommend stretching for my patient because one of the common thing, and even when you look in YouTube, the first thing is doing performance stretching. That's gonna make your sciatica get worse. Please do not do that. A lot of people think they are guru and they give that performance stretching, and even a lot of physical therapy doing that. That's gonna cause more inflammation. It's gonna cause more scar tissue, gonna make it worse. And I had patients actually get a lot worse by doing stretching, especially the performance stretch. Avoid it, please. The other thing is strengthening exercises. If we introduce strengthening exercise during the inflammation stage, that's gonna inflame it more. We want to do a strengthening exercise, but we want to do it during the right time. But there is much more important core stabilization and posture training, more important than stretching exercise, that's more effective to help correct your posture and decrease your risk of having issue with sciatica. So, how we treat the sciatica? We really need to address the healing cycle. So I'm gonna go over the inflammation, what I usually do to decrease the inflammation, and then what we're gonna do to break the proliferation stage. So first, inflammation. If you are in acute sciatica pain, rest. Take a time like 5-7 days. Don't do the activity that increase it. If it's acute condition that triggered by repetitive poor posture or lifting, by avoiding the trigger should be good enough for mild cases with the rest to decrease the inflammation and you start to feel better. If you're not feeling better and you have chronic inflammation, moderate to severe, we have to break this vicious cycle from both ends simultaneously. So what I personally do is I give my patient the MagnaHeal 2. The magnetic field is about 2 inches. So I have them actually wear it in the back. So actually that can reach really to even herniated disc in the back, or can in the performance area to reach that area to decrease the inflammation. So that's the first thing I usually do. The other thing is I give my patient anti-inflammatory diet, and I'll have videos on some option of the anti-inflammatory diet, because if you eat inflammatory food, your body gonna be slow to heal. So lastly, and that is extremely overlooked by a lot of healthcare providers, restoring deficiency. So your body need, for example, magnesium, D, C, B, to transition from inflammation stage to proliferation stage to maturation stage. And if you have deficiency in certain vitamins and minerals, your body will never gonna transition to maturation stage. You don't have enough fuel to get it there. You will be stuck between inflammation and proliferation stage. And there are several studies shows the correlation between vitamins and mineral deficiency and low back pain. So if you have those deficiency, you have chronic condition, we have to figure out the deficiency, because the MagnaHeal not gonna replace, for example, your magnesium deficiency or B deficiency or D deficiency. We have to meet those deficiency. So one of the way to figure out what could be a possible deficiency you might have is take advantage of Ask ASTR. It's askastr.com. It's a free online medical evaluation that will help you to figure out, do you have vitamins, mineral deficiency or other hormonal imbalance, and what steps you need to take to really address those issues. The software usually take about 5 minutes to answer those questions. The good news is it has a 9 healthcare provider database, so it's an extremely comprehensive evaluation to help you with this process. So take advantage of that, especially if you are in chronic condition that has a lot of inflammation and proliferation. You need to get to the root cause of the problem. Okay, so what we should do to break the proliferation stage? We have to work on everything here in the proliferation stage. So I'm gonna divide it to fibrosis and fascia restrictions, and trigger points, so you will understand what we can do to really get rid of those adhesion or dysfunctions. So first thing, the scar tissue. Our body needs the scar tissue. The problem when you have too much scar tissue that could compress on the nerve and arteries, and especially on the sciatic nerve, that causes radiculopathy. So what I personally do is I use the A3 to work on breaking the superficial scar tissue. So that's what I personally use, and we have to be careful when we use the A3 in relation to the inflammation stage. So the other thing I use for deep scar tissue is the A5, and I use the same tool to really work on the trigger points. So we address the trigger point, the scar tissue, and also the fascia restrictions. That's why massage and foam roller does not work, because with massage, what I learned in school, you use your knuckle, or you use your elbow to really work on deep adhesion, deep scar tissue. But mechanically it's impossible to really go deep with the knuckle or the elbow. That's why I invented the A5 to really go deep. And in the performance area, I actually had patient, I was able to go 2 to 3 inches deep in the tissue to do deep release. Think about this way: for the scar tissue, if you cannot go deep enough and exert mechanical force, it's impossible to break it. It's like you have in your motor a screw, you want to unscrew it, but the screwdriver you have is very short. So it's impossible to unscrew that screw. So you need to have the tool that actually go deep to do the deep release. And I use that a lot for the sciatica. So the other thing that extremely overlooked by a lot of healthcare providers, because there's not like good education and proper way of treating it, and that's why they say, oh, you use a foam roller to release the fascia release. That's not accurate when we understand anatomy. So fascia is, briefly I'm gonna go over this, but I have a video about myofascial release, go in depth about this system. But I will go briefly here because it's extremely important to understand the fascia system, because it's very relevant to treat the sciatica pain. So we have several layers of fascia. You can see it here in this image. Superficial layer wrapping the entire body, and the fascia is a white web tissue, as you see here, first image, the second and the third image. Very complex system, but the treatment is extremely simple. But I have to go over the system to appreciate why we need to work on different layers of the system. Okay, so the fascia system divided to 2 main categories. One is superficial layer, as you see here, and one is deep layer. The deep layer divided to 4 subcategories: apparatic fascia that wrapping a group of muscle, epimysin wrapping individual muscle, and premiysin wrapping a group of bundle of fibers, and at the end endomysin wrapping individual fiber. And you can see here, this is the epimysin wrapping the muscle, and you have the premiysin wrapping a group of fibers, and we have the endomysin wrapping each individual fiber. And that's why it's impossible for the massage and foam roller to release those layers, because it's not gonna go deep enough to release the endomysin, the premiysin, the epimysin. You have to have the tool to really go deep, otherwise you're not gonna exert mechanical force. To make it more complicated, but the treatment is simple, each of those layers divided to 2 or 3 sub-layers. So you have the apparatic fascia, there is 3 layers of the apparatic fascia on top of each other. That's why targeting those layers is extremely important, because when you have fascia restrictions, it's like you're wearing a t-shirt 2 to 3 size too small. And what's gonna happen, that's gonna compress on the sciatic nerve. So when your muscle is tight, like the piriformis muscle, it's gonna spastic. It's gonna be you will have muscle spasm, and the muscle gonna be tight and compressing on the sciatic nerve. So the treatment. So what I personally do for sciatica, I use the A1 and this tool to release the superficial fascia restrictions and release the operatic fascia. And for the epimysin, the premiysin, the endomysin, I use the A5 to go deep to release those tissues. So if your issue is sciatica related to the piriformis muscle, you have to have those tools to really release that muscle. If it's related to the herniated disc, we use the magna heel and I release the tissue around the spine, so when we do core stabilization, we will be able to help decrease the pressure on the herniated disc. If it's related to osteoporosis, the same thing. There's a lot of fibrosis, a lot of inflammation in this area. We have to release the scar tissue. We have to release decrease the inflammation simultaneously. So it doesn't matter what cause of sciatica. What's matter is understanding where your body is stuck in relation to the inflammation or proliferation. If it's purely in the proliferation stage, usually take a few treatment with the tool to really get that to the maturation stage. If there's inflammation, we have to address the inflammation with releasing the proliferation simultaneously. So what can you do at home now if you have sciatica? Well, there's several things you have to do. The first is we need to do core stabilization, and that's more effective than doing exercises, or I will avoid any stretching. So I'm gonna have video on core stabilization. There's a lot to cover on that. We wanna do proper posture, sitting posture, sleeping posture, walking posture, gait. And the other important thing is proper lifting body mechanics. So if you have back pain, I will avoid lifting at all means initially, just to help your body to recover and heal. And if you have to lift, we have to follow proper body mechanics, and I will have video on that. You want to stay active. You don't want to lie down all the time. As long as the activity is pain-free. So if you don't use your muscle, you're gonna lose it. So you wanna be active. Some severe cases of inflammation, it's require rest, but most of the cases we need to be active. You wanna do the motion that does not increase your pain. So, and simultaneously, we have to work on the inflammation and proliferation stage. So, working on decreasing the inflammation, or a person use the magna heel, anti-inflammatory diet. If you really in chronic condition, I recommend take advantage of ASTR to figure out if you have any vitamins and mineral deficiency that put your body in that vicious cycle. So that's actually the protocol to address sciatic pain. If you have any question or comment, leave it in the comment section below, and I will answer it in a future video. And I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.